The PEARRLA test is a standard eye examination that can help healthcare professionals diagnose a wide range of health issues, including vision problems and some neurological conditions. People may undergo a PEARRLA test as part of a physical exam, in the emergency room, or during a routine eye exam. PEARRLA is an acronym that stands for P, pupils, E, equal, R, round, R, reactive to, L, light, and A, accommodation. The pupil is a hole in the center of the eye. It looks like a black spot in the iris, the colored portion of the eye. Healthy pupils work by dilating to let in more light or constricting to let in less light. These adjustments help a person see in various lighting conditions, and they also prevent damage to the eyes. During a PEARRLA test, a doctor checks whether the pupils are equal. The pupils should be equal in shape and size. If one pupil is larger than the other, this may signal a problem. Round. Healthy pupils are round. If the shape of the pupils is unusual, this could signify an injury to the eye. Reactive to light and accommodation. Healthy pupils get smaller in bright or direct light, as well as when a person focuses on something very close to their eyes. To evaluate the pupils, the doctor will look at the eyes and note the shape and size of the pupils. Shine a light into the eyes to see whether the pupils constrict in response to bright light. Ask a person to focus on something close to the face to see how the pupils respond. Many factors affect the behavior and appearance of the pupils. Muscle and eye injuries or damage to the brain and spinal cord may cause abnormal PEARRLA results. For this reason, doctors often also use this test as a preliminary assessment of neurological injuries. The PEARRLA test is not a complete evaluation of eye health. It ignores some important measures such as the size of each pupil, the specific shape of each pupil, how quickly the pupils dilate or constrict, certain differences between the pupils, such as constricting more quickly or dilating to different sizes. Many PEARRLA test guidelines recommend that doctors add a darkroom component to the test. Assessing how the pupils dilate in a darkroom can make it easier to measure pupil function, and this is an important first test for certain brain lesions. Some research suggests that the PEARRLA test has become so commonplace that doctors may either simply glance at the eyes and then say that they completed the test, or fail to take full note of the results. To get normal PEARRLA test results, the muscles, nerves, and brain regions that control the pupils must all function well. Abnormalities in the test can therefore signal a wide range of conditions. In most cases, it is not possible to diagnose a medical condition based solely on the PEARRLA test, but the test is a good first step in the diagnostic process. The results of the test can help a doctor determine which test to do next. One of the most common causes of abnormal PEARRLA test results is AD syndrome, or atonic pupil. This condition causes the abnormal dilation of one pupil, though sometimes both pupils are larger than usual, which can cause pain in bright light. Some people with this syndrome also have weak reflexes, though many report no other symptoms. Several medical conditions, including syphilis, damage to the eye, and in rare cases, the varicella zoster infection can cause AD syndrome. However, doctors are sometimes unable to identify a cause. The test can also act as a warning sign for serious medical condition. The test results of PEARRLA may predict various medical conditions depending on the findings. Irregular pupil shape. If the pupils are not round, this could indicate trauma to the eye. A scratch or other eye injury can damage the muscles in the iris, causing irregularly shaped pupils. Tadpole pupil. This syndrome causes areas of one or both pupils to become larger, sometimes during or after a migraine episode. Doctors think that a spasm in the muscle in the iris causes tadpole pupil. Damage to the midbrain. If the pupils are oval or another odd shape, this may be due to damage to the pupil fibers that attach in the midbrain. Abnormal constriction or dilation. When the pupils do not constrict or dilate in the way that a doctor would expect, this might be a sign of 1. Drug misuse. Stimulants cause pupils to remain dilated, while opioids cause pupils to remain small. Damage to the central nervous system. A brain injury may affect the brain's ability to either send or interpret signals to dilate or constrict the pupils. Severe head injuries can damage the nerves that help dilate or constrict the pupils. Brain tumors or lesions. For example, when the pupils dilate at different rates, this may be a sign of a tumor or lesion in the optic nerve. Damage to the blood vessels of the brain. Sometimes an aneurysm presses on a nerve, reducing the ability of the pupils to dilate correctly. The PEARRLA test is one way to assess a person's risk for certain neurological conditions. It can also help healthcare professionals diagnose eye health issues and eye trauma. Although it is useful and acts as a good first step in testing for an underlying condition, the PEARRLA test does not take all factors into account. Normal PEARRLA test results do not necessarily mean that a person is healthy, and an abnormal test results does not enable a conclusive diagnosis. People who undergo a PEARRLA test should discuss the results with their doctor and ask them whether additional testing might allow for a more accurate diagnosis. The normal pupil size in adult varies from 2 to 4 millimeters in diameter in bright light to 4 to 8 millimeters in the dark. The pupils are generally equal in size. They constrict to direct illumination, which is a direct response, and to illumination of the opposite eye, which is a consensual response. The pupil dilates in the dark. The pupils constrict when the eye is focused on a near object, accommodative response. The pupil is abnormal if it fails to dilate to the dark or fails to constrict to light or accommodation. The popular acronym PEARRLA, pupils equal, round, and reactive to light and accommodation, is a convenient but incomplete description of pupillomotor function. It specifically omits important clinical data such as the actual size and shape of each pupil, the speed and extent of pupillary constriction, and the results of determining an afferent pupillary defect. The examiner must first check the size, shape, and equality and position of the pupils and their response to bright light. Because these phenomena are best tested with the pupils in a semi-dilated state, clinical observation should be made in a dimly lighted room. Patients should be encouraged to fixate visually on a distant object because if they inadvertently look at your nose or the flashlight, the attempt to converge will reflexively evoke meiosis, and certain signs may be overlooked. For the same reasons, try not to startle or touch subjects with your hands or instruments, as psychosensory stimulation induces mydriasis, hippus, and relatively hyperactive pupils. To assess pupillary size in a darkened room, illuminate the face from below. Slowly move the light up to the patient's eye level and check the pupillary response to the bright light on each side several times. Grade these responses from 1+ to 4+. Next, look at the amount of pupillary constriction that occurs when the patient is forced to focus on a near object, such as a thumb held 15 to 20 centimeters above the eyes. Record these data so that they are easy to read and recall.